Welcome to our first proper heart surgery mission day in Ghana. We've just left Accra, making off for Kumasi to meet Enoch Okoa, our surgeon. Enoch's one of our surgeons, but he grew up in Accra, but he left at 15 to school in England, then medical school, then to become a consultant cardiac surgeon. And he's been with us for around 10 years in James Cook. And while he comes back every year to Accra to meet his parents, this is the first time he's ever come back to do a heart surgery mission here. He left a week before to get everything ready, so now we're going to meet him as he picks us up at the airport.
Hi Emily, welcome to Kumasi.
Great to meet you.
Yes, to meet you finally as well. I'm really excited. I'm hugely excited to meet you and hugely excited about the week that we've got planned. So, it's
wonderful.
Really good.
You've been doing all the heavy lifting while we've been
Well, I'm hoping it's going to be a smooth ride from here onwards.
So what have you got in store for us today?
So today it's all about setting up. So we're going to get some lunch and then we're going to go straight to the hospital. We're going to set up an ICU and a high dependency unit and a theatre and hopefully have a dry run so that we're all set to start tomorrow.
Yeah. And you kind of come from Britain, but what's different already? What do you notice that's different to home?
There's a nice easy pace to life, which is good. But in many ways you're still dealing with professionals who just want to get the job done, so that's good. And I've met lots of really good people who are going to help us have a good week. But of course, all the kits and the equipment that you need isn't quite what you're used to and isn't necessarily in the right place that it needs to be for us to get our work done. So so it's challenging, but it's going to be good.
Yeah, that's great. And Emily, you've been before here. When were you last here?
My last visit to Kumasi was in 2016.
Yeah, and what did you find here? How did you find the surgery here compared to other places?
Well, I think what Enoch said is absolutely true. It's a group of professionals that are hardworking and want to do the best for their community. So we're really eager to continue that process and empower the local staff and hopefully get some good work done.
Great. Well, let's get going.
Hi, I'm Peter. I'm an anaesthetic nurse. My role on this mission is going to be assisting Dr. Foley and Dr. Spegar. Also, Spriver has been a small team. I'm going to be assisting Caroline on the scrub side of things, and even maybe dabble a little bit in ITU if I'm required. But really looking forward to it. Really excited for the challenge and bring it on.
Right, so welcome everyone. I just thought we'd take 5 minutes so that we'd introduce ourselves so that everybody knows who everybody is. The plan after that is we have to go to the stores to get our equipment, and every group will split up into groups. So the ITU guys will bring their kit here. Those who need to go to theatre will go to theatre. Perfusionist or Kakari will be here, and then we'll start the setup. Okay, and then at the end of the day, if we manage to set up, we'll do one dry run so that we're planning to do a case tomorrow if at all possible, unless we come across any hitches during the day, if that's okay. So what I might do is I might get the UK guys to introduce themselves, so maybe just say what your name is and what your role is, and then once you're done, we'll get the Ghanaian team to introduce themselves as well. So maybe I'll start with you, Mike, actually, if that's okay.
Okay, I'm Mike. I'm an anaesthetist and intensivist.
So Mike, Nana is Nana's an anesthesiologist as well, so he will be your key link man. Okay. And then Kim?
I'm the perfusionist.
Okay. So Kim, Kakari is in here, but Jonathan, you better do that with your microphone.
Yeah, I'm Jonathan, and I work as a video journalist for the BBC.
Alison?
Hello, I'm Alison. I'm in ITU there.
So Mama Dell. Mama Dell is the big ITU cheese. She's in cheese. And Mama Dell will be doing the ICU rotors and everything. So she will be organising. Okay. And then Jan?
Hello, my name is Jan. I'm an anesthetist and intensivist. So we're going to support each other.
So Nick?
Yeah, I'm Nick. I'm a cardiologist. I specialise in imaging. So I brought along a TOE kit so that we can scan the patients before, and we've got some smaller echo machines we could use if need be to help with the patients after, and possibly help with other cardiology patients you may have.
So Andy, where's Andy? One also do cardiology.
Yeah, hi, I'm Andy. I'm another cardiologist, so I'm the pacemaker man.
So we have 4 cardiologists here already. So maybe if you introduce yourself and then.
Yes, maybe. Yeah, it's our boss. He's our team leader.
So I'm Yawadu Wachi. I'm also a cardiologist at Confirmatory Teaching Hospital doing interventions.
Lambert?
Lambert, up here. Also a cardiologist here.
Cardiologist interventions.
And this doesn't happen anywhere but Akko. So Dr. Akko has another cardiologist as well. So 4 cardiologists here. Right, Fiona?
Hi, I'm Fiona. I'm an intensive care nurse.
Emily, everybody knows Emily already.
I think the local team probably knows me better than the UK team, but yeah, nice to see you all again.
And then the MVP is Emily.
Always
Amos.
MVP.
Amos. So Amos is our biomedical engineer. Amos has been here for the last 2 days setting up all of this. So if anything needs fixing, from blood gases to bypass machines to ventilators,
Yeah, that's me.
Okay, so there are 2 of them, and we're hoping they're going to be here 24/7. So they'll be here all the time. So if anything gets broken, then the guys will fix it. Should we do a little tour? That'd be nice. Should we have a little walk around the unit then? So we know where we are? Okay. So this is intensive care. Yes. So let's start. So intensive care, we have 4 beds. There are 4 beds.
4 beds.
How many ventilators?
3.
Okay, so 3 ventilators, 4 beds. Mike, and Jan. So just talk about ICU. So in terms of moving patients around, we're going to move them on a mask, aren't we? Bag of mask. But it's not a very long distance.
No. It's just.
Okay. So we've got portable oxygen. Anything else? And then you're setting up the monitors.
Yes, these monitors. And that is the same monitors at the theatre. So in terms of compatibility, we don't have issue.
Perfect. Okay, so we'll go next door to HDU so we all have a look at where things are.
So in case, the pacemakers, for the first day, since we don't have only one pacemaker, one open heart, but for the first 2 days, you can have the 2 close-ups here, the pacemaker and the open heart. But the standard we go there, which was a second step down.
Okay.
So in case we have more patients,
and that's not monitored,
we couldn't have monitored.
We're going to have monitors there as well. Okay.
As well, yeah.
And then this will be our final step down. So kind of HDU step down and then pre-op. So it's all here. The main ICU is at the end of this corridor. And then theatres is across. Oh, okay, across. Oh, okay. Right. So if you put your stuff down, and then we'll go to stores.
Is it a way of working? What's the difference between here and Middlesbrough? Was that a highly charged question, or are we on the spot with
It's
that?
not a fair question, I guess. Normally I turn up to work and everything's obviously set up. So we're basically creating a whole new department. So it's completely different. But it's good fun. It'll help me know what actually goes into the stuff that I do every day. Because actually normally I turn up is all there. And it's amazing what needs to happen before you actually get operating.
Yes.
Oh my word.
Is that your stuff?
I hope it's not all our stuff. It's not all our stuff.
It's had children. And children's children.
Okay. Shall I into the entity? Okay, well, Tim, you got a list, haven't you? And you were putting it together.
Really?
I've got a big list. Boxes, but I don't know what all the boxes are because you've numbered them all differently. I've only got 13 boxes. I can see some number 120.
Seen before.
Number 120 is Andrew's box.
That's one of mine.
How do you know it's one of yours?
It's got black
gaffer tape on it. There you go.
I almost make it work for these guys.
Did you? It's alright.
Yeah.
Do more.
So do this then.
In charge here, this is really worrying.
Where do you want the
So this is going to theater. So theater here.
Yeah.
And I'm basically taking this stuff to this. This is Andy.
Yeah, good.
This is perfusion and theater. Yeah. So for you, mate. And this is anesthesia and intensive care.
3 sockets.
Something with 29 or something.
And then I've got a few rings.
Okay, so there's a history of rheumatic arthritis, OMR. She's got a prolapse and too much of power with That's helpful, thank you. Okay, it's nice to meet you.
Just 9 years.
I'm Dr. Child. Hello. And has she had children?
She doesn't want any children anymore. She's had enough children. 2 is enough.
Mi va to mi baby. Mi guardi, mi vedi la mi pian para la.
It's basically safe now married. So she's officially not married. And it was, how should I put it? The reason she terminated her pregnancy was because she wasn't ready. It was boyfriend, girlfriend kind of thing, and it came up. So she's officially still not married. So she's still desirous of baby, but it will be in when she gets married.
Yeah. Okay.
Joel, I'm a heart surgeon. And, so we're thinking about changing one of your valves. And,
so just go ahead. I'll be doing that at the same time.
So we're thinking about changing one of your valves, and the valve we change it to, there are 2 different types, and there's a big difference between the 2. So I just wanted to let you know about the 2, so you could think about which of the 2 is the best to have. There's one that's made of metal, and you have to be on a tablet called warfarin, and it lasts forever. So you can live a long time with these mechanical valves, and then you just have to take a tablet called warfarin. There is another one which is a valve made out of tissue, which does wear out, but you don't have to take any tablets, and that does wear out after about 5 to 7 to 10 years. The mechanical one that's really good, you can't have children if you have that valve in, because the warfarin tablet is not good for children for having new babies. The biological one, you could have further children, but it's going to wear out. So it would be a difficult decision that only you would have to make. But we do have both available.
She's not going to get officially married. She desires of pregnancy and stuff like that. It's just like health first. She wants to be healthy first, and then the other things can be later.
Can you try and swallow?
Minute.
It's okay. Why address?
Just breathe.
Yeah.
I'm just going to go up and down through the valve.
Nobody knows that. Ventricle doesn't look that great, does it?
And the ventricle's down. So you see that posterior leaflet there?
Yeah.
And then put the colour on it. P's is 1.
Okay.
Ventricle's down.
When I contract the 0.8, 0.9.
Is that lots of TR then?
Yeah, she's got pulmonary hypertension. It was coming out at about 40 plus RA pressure.
Aortic valve looks alright, Nick?
Aortic valve's lovely. Just grab that one.
That's not much TR.
Yeah, but this is not
Oh, that angle, that's very much. There you go, Enoch. Is that enough for you?
Make it as much as you want. You know that.
So we're doing the tricuspid as well?
I suppose we should. We bought some rings, didn't we?
I got 1 ring, otherwise you can do De Vegas.
Yeah.
Would you do it, Emily?
Yeah, that's nice.
Yeah, we've done De Vegas. Oh, what I do in this case, I haven't seen it well enough.
So So let me just get
that. You must be very happy to see that.
Well, it will be when we switch it on.
Let's
smelly. It's more smelly. It's more smelly now. It's good. Smell more.
Yeah, smile because it spins. Yeah.
Welcome from the long missing away.
Is it going well?
Yeah, it gets it. It's lovely and cool in here.
Oh yeah. I thought you liked the heat. You're just happy seeing all your equipment, aren't you?
Maybe
Caroline big bowled and steeled everything, didn't you?
No, I didn't. We bought them.
Oh, this is bought, is it? Specially?
Like bowls.
Yeah, this is
amazing.
And that's brand new.
So this is our MDT.
Yeah, this is the thing.
Yeah, this is our MDT. This is the world's best MDT. We've got beers and echoes.
It's 25 degrees.
Yeah, it's Africa time. Yeah, why can it be like this in Middlesbrough?
We're all turn up at the MDC.
Yeah, we would. Yeah, we would. Cheers.
Absolutely. Thank you. You did a sterling job today.
Oh, well, it's great.
You actually took some proper work.
Actually worked, yeah. Worked my beer.
Yeah, and it's your turn tomorrow.
So it was a very successful day one. We're all looking forward to an extremely busy day two, where we're going to perform our first operation, do some training, and hopefully even do some teaching. So tune in tomorrow to see how we get on.